Extending research-based advocacy to all Nigerians forms a critical part of the NESG mandate. At different times, the NESG conducts research-based advocacy by employing public education and community mobilization strategies.
The diversification of this economy is very, very important.
Research-based advocacy allows for social voice, prioritization, and bringing different actors together for dialogue towards sustainable and inclusive development in our country. Welcome to NESG Radio.
Hello, everyone. My name is Shona Oladire. I'm a NESG Bridge Fellow. Basically, the NESG Bridge Fellowship is designed, to inspire and equip a new generation of young visionary Nigerian leaders with the skills to carry out policy-oriented research and advocacy for national transformation. And, being here today, I just remembered how that it was at the peak of the Covid-19, lockdown. That's when I got this email, right, to say that, Shona, you were selected as a Bridge Fellow. And then joining the community of, other Bridge Fellows, we were to come up with a project. And then we thought one of the best ways to maximize, our fellowship, experience was to do a research, right, on the impact of the COVID-19 lockdown on households in Nigeria. And today, we're going to be sharing, some of the key findings that we were able to get from the report. Thank you.
Hello, thank you very much, Shona, for the very warm introduction. It's been a pleasure to be part of the Bridge Fellowship program of the NESG. I am a trainee family physician and I double as a Bridge Fellow, and it's been an exciting journey working with other like-minded, amazing people on the Bridge Fellowship program. It's good to be here.
Oh, great. Thank you so much, Dr. Ibrahim. We're happy to have you. Dr. Adams?
Okay, thank you so much, Shona. My name is Adams Adeiza. I'm currently a senior lecturer at University of Malaysia, Kelantan. I am with the Faculty of Entrepreneurship and Business. I teach strategy and leadership. I am also a Bridge Fellow, and like my colleagues, Shona and Dr. Ibrahim rightly mentioned, the fellowship has been an exciting experience for all of us. We have been able to get equipped with exciting ideas, leadership skills, policy research tools, and we can proudly say that the program has been an exciting one for all of us. Thank you.
Oh, okay, great. Thank you so much for the, introduction. And also, we'll just, dive right into, the discussion for today. But then before then, I just want to know, Dr. Ibrahim, I know how that you've been, at the forefront of, defeating this pandemic. And you being the medical doctor in our midst, how has this journey been for you? What has it been like, right?
Thank you very much, Shona, for this take, having to take the first question for the day. COVID-19 is an unprecedented public health crisis in living memory. Many of us who are practicing have never seen such a public health crisis. And as I said, in living memory, the teachers of our teachers too have not seen such an unprecedented event. It is already a year since COVID-19 first case was reported in Nigeria on the 27th of February of 2020. The situation in Nigeria was of dire concern because COVID-19 outbreak surfaced at the heat of the largest outbreak of Lassa fever in Nigeria. Lassa fever, a viral hemorrhagic fever that is very fatal. Lassa fever claimed many healthcare workers' lives, and indeed it was worrisome considering the healthcare personnel to patient ratio in the country, which is grossly below the World Health Organization standard. It therefore goes that the country could not afford to have an instance where a doctor reports in sick or let alone die from avoidable circumstances like contracting and succumbing to COVID-19. Broadly speaking, I would highlight some major challenges that we see with the COVID-19 outbreak since it first surfaced in Nigeria in February of 2020. The COVID-19 pandemic really brought to light the infrastructural deficiency in the whole health system of the country. The heat of the COVID-19 exposed inadequacies in our healthcare system, ranging from that of basic infrastructure, such as the hospital facilities and equipment, to the shortages of human resources. This gross inadequacy really handicapped Nigeria's testing capacity at the wake of the COVID-19 pandemic. That was where at the initial stage we were seeing fewer cases than it's reported in countries with similar characteristics as Nigeria. And everyone wonders, are we really immune to COVID-19 or we are not testing? But the truth of the matter is we were not testing at that point in time. And for us in the health sector, it was really a catastrophic event. Let me give an analogy. When flight bound and there is low oxygen on the cabin, the onboard safety instruction clearly says, put on your mask before you helping others. This flight safety metaphor simply puts it that you cannot help anyone else when you are helpless or dead. So to effectively help others, one needs to be well protected. So this analogy is trying to talk about the lack of personal protective equipment for Nigerian healthcare workers. Recognizing that these health workers are on the front line, helping to fight the COVID-19 pandemic at substantial risk to themselves, it shows that this metaphor really speaks to the protection that without them getting protected, they cannot help to protect anyone else in the society, which means if we do not protect the healthcare workers in the front line, we risk losing everyone to the heat of the pandemic. Thank you, Shona.
Oh, great. Thank you so much, Dr. Ibrahim. It's really, interesting hearing from the medical, like someone in the field, talk about this, because it's amazing how that we don't even remember like other health issues, right, that we have in the country, like, for example, Lassa fever and like a host of other issues. But it's really great hearing you share about, how the other health, crisis is like sort of affected the COVID-19 and our response. Okay, I'll just move on to Dr. Adams now. And I know that you were like working on this, report. You were like one of the lead researchers. But then I just really want you to share on how, like, why you decided, why we decided in the first place, right, to come up with like this study, and for you to also share, why you decided to do like an empirical research on the impact of the lockdown. Were you expecting, I'm just like, I'm sure people are curious to know, were you expecting like a negative impact already, like before doing it? Or like why exactly, did you come about like having an empirical research for the COVID-19 lockdown?
Okay, thank you so much, Shona. You see, when the pandemic hit and subsequently there was a lockdown, which came with severe socioeconomic consequences for everyone, nobody knew exactly how to respond. One, to protect lives, but more importantly, to preserve livelihood. So in line with the NESG tradition of evidence-based advocacy and policy recommendation, we, the NESG Bridge Fellows, decided to conduct the study to offer government and other stakeholders reliable insight for doing basically two things. Number one, to provide insight, that will help government provide appropriate, intervention that will alleviate the suffering of the Nigerian people. And secondly, to provide evidence-based approach for addressing the inevitable long-term consequences of the pandemic and, of course, the lockdown. Now, let me just quickly, walk you through some of the key highlights of the study. So the study involved 2,045 participants who completed the online questionnaire, and another set of 54 heads of households that we interviewed. So participants came from all states of the Federation, including Abuja. So Lagos had the highest number of participants with 24.9%, followed by Kano at 22% and Abuja 12.5%. So in terms of just some quick highlights as to the feature of the people that participated, 65% are male, 48.9% are married, and the common types of the common type of household that participated in this study was the one with parents with 3 to 5 children. That's about 27.6%. And although I know we'll come to discussion in detail as to the key findings regards to economics and so on, let me quickly mention that our study quickly revealed that 17% of participants at that point in time recently lost their livelihood, their jobs, and 54% of our participants have experienced negative change in their source of livelihood. So this is it about the study, about why we decided to conduct the study, and just some few highlights. So I'm super excited to share more on what we found, as regards socio-economic impact, both for the short term and the long term for Nigeria. Thank you.
Oh, great. Thank you so much, Adams, for sharing. That was very insightful. And, you already started giving us, teasers about, some of the key findings in the research that we did. And, speaking of which, one of the things our report showed was that a whopping, 54.8% of respondents actually experienced a negative change in their source of livelihood, ranging from, loss of job, drop in sales, for those who own businesses, and also reduction in salary. And then when we gathered this, it was just 1 month or 1 or 6 weeks into the lockdown. Dr. Ibrahim, I'm really concerned. What do you make of these figures? Having to know that 54.8% of the people actually had that negative, changes in their source of livelihood within a short period of time.
Thank you, Shona. There's actually a silent crisis within this COVID-19 crisis behind those figures that you just quoted. Knowing that 65% of Nigerians work in the informal sector, and the informal sector is grossly casualized with weak labor rights, that is characterized by daily earnings, where to live is to just click a wage day by day. And that Nigeria records a considerably high proportion of poor people in the world, having over 40% of the population of 200 million Nigerians living below the poverty line. With the United Nations projecting a population of about 410 million by 2050, this percentage of impoverished Nigerians is not only unsustainable, but it's potentially a significant destabilizing factor for the country, as about 67% of this projected population in 2050 will be young people between the ages of 35 and below, and without jobs that will cater for this ideal population of youths. This COVID-19 pandemic has triggered a systemic wide range of issues across the political, economic, and social dimensions, which left more of our citizens more vulnerable, as we've seen in these figures that we got from the study. Looking at our study participant and then projecting it as to the wider population. While efforts are being made towards, Agenda 1 of the Sustainable Development Goals to end poverty, the ripple effect of these public health regulations, such as the lockdowns and closure of businesses, really casts a cog in the wheel of our progress to poverty eradication. The catastrophe of COVID-19 placed millions of Nigerians who are already hanging by the edge of the woods to extreme poverty. They were only hanging, and then COVID-19 came like a hammer, hitting them hard, and then sending this considerable section of the population who can only eat if they earn a wage to the edge of poverty. Hope is not all lost, as we've recommended, as we'll come to see in the subsequent section of this our report. We can rise as a nation by building a robust national governance network of social protection that is collaborative, with coordination at the center, with frameworks for governance, organization, and processes, and stakeholder engagement, with the political will for funding, research, monitoring, and evaluation, so that no one is left behind, and we can be able to cater for this growing population, and then those who have been hit so hard by the COVID-19 pandemic.
Oh, great. Thank you so much, Dr. Ibrahim, for sharing. And then it was really good, you were saying it's like a crisis, right? In crisis, right? And then, but I really love your optimism. Like, we kind of, like you're saying how we can take steps, right, in order to change the trajectory of things. So that's like very, profound. And, still discussing about, the standard of living and the economic situation in the country. Dr. Adams, I know that you're constantly at the forefront of developing like policies related to business, and you also, teach strategy. One of the things our report revealed, which is it's concerning as well, is that 64% cannot provide for their families if the lockdown, extends beyond 4 weeks. It means that, a lot of Nigerians cannot, to cater for themselves, if they don't have like a source of income for just a month. I feel like, the time frame is like really short, knowing that, or just if the lockdown has extended to 4 more weeks, it would have been more difficult for people to feed. So what does this tell you exactly about the standard of living in the country? Where did we get it wrong? What is like what does this really say about, the current standard of living in the country?
Okay, thank you so much, Shona. It's simple. What it tells us about the standard of living in Nigeria is that it's pretty bad. And the truth is that it has been bad for quite some time. Like Dr. Ibrahim mentioned, Nigeria is effectively the poverty capital of the world, with 82 plus million people, considered to be poor. Some, poor in multidimensional way. Think about the fact that 55%, we have 55% unemployment and underemployment rate. That's a whooping, loss of, human productivity, and that also shows, the level at which, people don't have, source of livelihood. People don't have economic opportunities. So if all these are lacking, imagine Nigeria's per capita income, just roughly 3 decades ago was times 2 of that of China. Today Nigeria is just, hovering around $2,000 per annum as per capita income, whereas China is surpassing $10,000. So when you look at all these, and let me also quickly mention, before COVID hit, Nigeria National Bureau of Statistics had conducted a study, called National General Household Survey, that revealed that 32% of Nigerians experience food shortage. Over the last 12 months preceding the survey, which we could basically generalize as 32% of Nigerians experience food shortage on an annual basis. And the same study revealed that 44% of Nigerians indicated that, they are not being able. That means at that point in time, they know that they cannot provide for their family nutritious meal. And like Ibrahim mentioned, we are signatory to SDG, and we need to improve our system. We need to improve our socio-economic condition to be able to meet some of those goals. Even though, like UN said, even before COVID hit, some countries were already on track to missing some of the goals. So essentially, our findings just simply show, or that COVID just came along to reveal the fragility, the country's fragility in terms of socioeconomic condition. And frankly speaking, it is frightening. It's just like a ticking time bomb, and something serious has to be done to alleviate, to change this situation for the better. So we'll talk more about some of the ideas that we have recommended as the podcast proceeds. Thank you.
Oh, great. Thank you so much, Adams. You sharing how COVID-19, more than it just being a health crisis, it's actually like a revealer, right? Revealing the different economic situation that have been buried, over the years. But, I want us to delve a little bit deeper, right, into the health situation, because one of the findings that our report showed was that about 71% of respondents did not have any form of health insurance. And the NHIS was created in 2005, in order to expand health insurance coverage across the country. And then, knowing that, from the research, right, we see out that 71.3% did not have any form of health insurance. And according to a report that was released sometime last year by NOI, it showed that only 10% of Nigerians, right, had access to any form of health insurance. So what do you think we can do, right, in order to expand the percentage of people that have, access to health insurance in Nigeria? Dr. Ibrahim.
Thank you very much, Shona, on this. As it is, for us to achieve universal health coverage, where there is equity and access to qualitative healthcare by all, without leaving anyone behind, there is need for the political will to invest in the health sector. There are several studies that show that countries do not actually lack the finances to finance the health sector, but it's the lack of the political will to properly channel those available resources judiciously to enable people access qualitative health care without earning catastrophic health expenditure. It is quite heinous for someone to succumb to a disease where for the fact that he cannot afford to pay. The lack of capacity to pay for health care should not be a reason for deprivation or lack of access to health care. So as it is, the book lies on the government to pull out the finances and expand the resource envelope. One of those ways is to live up to the responsibility of Nigeria as a member of the African Union. In 2001, African Union heads of government sat in Abuja and agreed that each country should allocate at least 15% of its budgetary allocation to the health sector. In Nigeria, it has always hovered between 5 and 6%. And sadly, in 2021, the budget proposal, it's barely over 4% that was allocated to health. This is even at the ongoing pandemic. And similarly, Nigeria has enacted the National Health Act since 2014. And it has not been implemented to the letter. Within the National Health Act, there are frameworks for improving funding to the health sector, which includes the 1%, at least 1% consolidated revenue fund being budgeted and allocated to fund basic healthcare provision fund. With such financing, the health sector can build up, and then we can have more people covered by health insurance. And the truth of the matter and the fact of the matter is that to cover the poor and the most vulnerable section of the population, it has to be taken by public spending. That means the insurance has to come from the government. For a poor widow who is only a peasant farmer in a village who suffers from one of the geriatric complications, cannot afford to give any premium to a private health insurance. Her insurance has to come from the government coffers by funding primary health care, where she can access primary health care, the continuum of care within one roof and accessible to her at her level of community. Thank you.
Oh, great. Thank you so much, Dr. Ibrahim, for sharing that. That was really, insightful. And you talking about, the need for political will for people to, would need a lot of political will for people to be able to access, more health insurance and have more health insurance coverage. Speaking of which, now we've touched on the health, but then I also want us to discuss briefly about the educational, system, right? And knowing that from the report, right, the research was done, 67% of applicable responded indicated that children's education, had been negatively affected as a result of the lockdown, and then this is very, interesting because we're all Nigerians. We probably, went to school without having, maybe just a few schools had access to having tablets or even computers being introduced from a very young, age. So we're not used to e-learning and all of that. So I want to know, from Dr. Adams, what steps do you think should be taken? Because obviously this figure shows that there is an urgent need, right, to improve the educational system in the country in case of a future reoccurrence. We're not planning for another, a second, obviously there's a second wave of COVID-19, but we don't, foresee having another lockdown. But any other thing can happen. There can be another pandemic in future. What steps do you think should be taken in order to improve the educational system in the country?
My position is that before we start talking about steps to be taken to address the issue, or rather, I think an important part of steps to be taken to address the issue is to appreciate the current state of affairs of education in Nigeria. So before the lockdown, the situation was already very bad, very, very bad. And, we could actually, share 3 or 4 reasons why, Nigerian education system has been progressively bad. And the first of it is that there is little in the way of, investment into the system, investment by government, especially. Education is a social service. And, that means that government has to make significant investment into it. Year in, year out, budget after budget, the allocation has always fallen far below the UNESCO recommendation of 26%. I think the current budget, the recently passed one, is around 7%. And with that level of inadequacy of critical resource, there's no way we can get the kind of education system that will respond to the kind of lockdown that we saw early on in the early part of last year. That's one. The second part, which could be related or a direct, consequence of the first point, is the fact that the teachers are poorly trained and poorly motivated. As a teacher, you can give only what you have. So if a teacher does not know enough, so you can be sure that the students, in most cases, will also not know enough. So remember, ASU was on strike for nearly a year, if not more. So how can you run a country? I mean, what you can almost sit in. You don't even need a survey or research, to be able to understand what kind of result you will get, as far as the education sector is concerned. When young people that are supposed to be, getting the best of training to take the country to where it should be in terms of development, don't even have access to schools, don't even have access to the right training. So you can almost imagine how the future will be. So the third factor in my analysis of the current situation is the fact that, again, it could be traced to the very first factor, which is in lack of adequate investment, is the fact that there is lack of requisite solid infrastructure needed to ensure effective learning in most of our schools. The second point was about, soft infrastructure, which is teachers training. But there's also an equal lack of, solid physical infrastructure in terms of teaching aids, in terms of learning aids, in terms of, all the things that make a school a school, So with all these, obviously Nigeria was grossly unprepared when COVID happened. Unlike other countries that immediately activated their virtual learning system, most schools in Nigeria, could not do that. Even some that had money, that probably shouldn't have a problem of physical resources. They did not have the soft resources. They do not have, the required training. Their teachers could not deliver anything. So, and when you also add into the mix the fact that Nigerians were battling with poverty and, unemployment, most households could not afford, devices for their children, to join the few, programs that are out there for students to learn with. So these were the situations this was the situation Nigeria was in before COVID happened. And COVID, again, just like in almost everything, came to unravel, came to reveal the fragile system that we had. So talking about direction, talking about next step to take, we can't run away from it.
Dr. Adams, that's, you're just going to lead me to like the next question, right? It's like, and then it would just be great if you just take that because we're pressed for time. What are, like, apart from just the next steps, right? I also want you to share of the lessons that you think the private sector and the government can learn, from the lockdown, from other countries and how we can respond to this better. So if you can just take the both of them in like 2 minutes, it would just be great.
Okay, so in terms of lesson generally, I will come back to education specifically. Lesson generally, I think, the number one lesson was that Nigeria did not have the requisite database that could at least inform a well thought out approach, to handling things like this. So thank God, effort is now being made, to create a reliable national data bank right now. So because without data, you just simply be shooting in the dark. So we did not have that. I think the lesson moving forward, and I'm happy that some efforts are being made in that direction. The lesson moving forward is that we should put high premium on gathering reliable socioeconomic data, upon which important decisions could be taken. If Nigeria had the right database, I think the intervention, the intervention both from government and private sector could have been better administered. People that didn't need some of the relief materials ended up getting them in large quantity, whereas those that really needed it, in fact, as our findings, show, 1 out of every 10 Nigerians said that, the intervention was poorly administered. And, while we know that some factors could have, played a role, like, I'm sorry to say the usual Nigerian factor, but I think to a large extent, the fact that there was no reliable data to work on contributed a lot. So secondly, which is my last point, is I think in retrospect, the entire country should have been shut down as it was done. Nigeria was so economically in a bad shape that we couldn't afford to shut down the entire country the way we did. So there is a way it could have been managed, like what I've seen in Malaysia, what they did. They also had that problem earlier on, but they quickly, because they had data, they quickly realized that there was no need to shut down the whole country. They only locked down specific states and red zones, they classify the country into red,
green and blue zone, depending on the severity of the infection. So they only shut down the red zones and let other, as part of the country to continue operating and contributing to the economy. So these are some of the points that I think, we could have, done generally to better manage the pandemic and the lockdown. But quickly on education, so there is we can't run away from it. There must be a deliberate effort to increase investment into education. And it's not even so much about lack of money. It's about, application of the little resources that is being voted. There is a need to constantly to follow the money and ensure that the little budget being given to the sector is actually used as it should be. It should be.
Great. Thank you so much, Dr. Adams, for shedding light on that. And I love the balance that you've brought in, because usually we just get to hear people say, more money should be pumped into the system. But I love the fact that you're like, okay, even before more money is pumped into the educational system, let's ensure that we use the money that has been allocated judiciously, right? And that is very, important. Thank you so much, Dr. Adams. This was very, insightful, and I can see your passion, speak through. Okay, so Dr. Ibrahim, on a lighter note, our report was not all shades of, this, crisis and, sort of like all these, figures, that alarming figures. We also got some interesting, feedback and, findings. And one of it was that 54% of the respondents actually said, there was some improvement in their relationship. They expressed having happy and satisfactory time with their spouse during the lockdown. And of course, this has a very good impact on their mental health. So my question is that it's good that they're having this great feelings and, in terms of their mental health. We're seeing benefits of this in people's mental health. But how do we balance the benefits of the lockdown like this with other negative, effects that we've spoken about?
Yeah, thank you very much, Shona, for this question. In fact, it was an appreciable figure for us to find that, majority, about 54% of our respondents were in a happy relationship after during the heat of the Covid-19 while in lockdown. This is opposed to other studies that emerged from elsewhere, where there were reports of increased incidences of sexual and gender-based violence, where violence against women were reported between spousal violence, violence from co-tenants or landlords, as the case may be. But for our study, it was quite appreciable that majority were in a happy relationship. And at the beginning of the lockdown, the public health terminology we had was social distancing. So social distancing was now connoting some negative effects among people. When you say social distancing, people define it in the layman's terminology as to keeping away from people. And we understand that keeping away from people negatively impacts mental health. So a lot of public health practitioners were now constrained to rather use a more friendly terminology, the physical distancing, so that people will understand that the public health precaution needed is to keep about 6 feet away from other individuals and then mask up, but continue to interact socially with the family and friends so that you keep your mental health going. And the other side of it, just like you said, on a lighter note, there were other ripple effects of this happy relationship during the lockdown. As we came to see in practice, subsequently, in recent days, there were some babies that are termed COVID-19 babies, probably during the lockdown because conventional clinics were closed. So reproductive health clinics like family planning clinics were not available. So couples could not, who are using contraceptives that required practitioner to administer, were not able to access those contraceptive devices and pills. And as such, they ended up having unplanned pregnancies. Coupled with the lockdown and loss of socioeconomic means, it means those clients, when they come to deliver around this moment, in this January, February, they were not having, the finances to finance the perinatal services, that's intrapartum services during delivery. So this is another issue that really impacted the lockdown, as it were, regardless of the happy relationship that people moved, but it really helped the mental health well-being of those who were in a good relationship at those moments. Thank you.
Oh, great. Thank you so much, Dr. Ibrahim. Dr. Adams, we have you now.
Yeah, I'm back.
Oh, wow.
Okay. Thank you. Sorry for the mix-up.
Okay. All right, then. Great. So do you want to take the answer to the question?
Okay. Let me just go straight to the answer, right? So you were asking, what I think should be steps to be taken to...
Okay, so Dr. Ibrahim, for the final question for the day, it's like the same thing. I just want to, it'd just be great for you to share, right, what steps you think we can take in case of a future reoccurrence of, another lockdown. What steps do you think, what lessons can we learn from other countries? And how do you think the government can respond, better? And even the private sector, how well do you think they should respond to this? Thank you.
Thank you very much, Shona. As we highlighted in the concluding report and policy imperatives of the study we conducted, there were quite lapses noted with the whole response to the crisis and the crisis that occasioned by COVID-19 pandemic. So moving forward, there's a need for enhancing our legal framework to conform with time and then global-based practices. Then the whole burden was on the vulnerable section of the population, those who really require social protection. It has been studied that over 70% of the over 36 million Nigerians that are excluded from, that are financially excluded, have telephone lines. That means the teledensity of Nigeria is over 97% as reported in some quarters. So with that teledensity, it means we can really reach out to the vulnerable section of the population, employing the best in technology, as earlier highlighted by Dr. Adams. We need to rely on technology to build upon our social insurance, social protection policies, building a national framework that is coordinated at the center with the necessary legal framework and coordination, and then the political will of funding by the government to ensure that no one is financially excluded or no one suffers brunt of a catastrophe like the COVID-19 just because the person is poor. Because the whole aim of social protection is to protect those vulnerable section of the population, that no one should be left behind and everyone should be at par. There should be those minimum flows of social protection that look at this level, everybody should be able to access basic health care. Everybody should be able to have the universal basic education for their children. These are basic social protection flows that the country should adopt as given and provided for by international instruments like the International Labour Organizations and the United Nations. Similarly, there's need to to look at the a comprehensive review of our national crisis management with a view to foresaw further possibility of a lockdown should we have a high-hitting second wave of COVID-19. Our crisis response should be proactive rather than reactive, with requisite planning prior to the onset of an outbreak, so that we can be able to smoothly sail through pandemics. As we know, in public health domain, COVID-19 will not be the last pandemic the world would come to witness. But what we know is that even though the microorganisms that occasion such pandemics are invisible to the eye, but they are not invincible, which means we can really fight hard and carry everyone along and sail through the pandemic and live a worthy and protected life after the pandemic. Thank you.
Great. Thank you so much. I mean, this was a very, very insightful conversation. And, just learning from, one of the major things that we've learned in the course of our Bridge Fellows, understanding the policy cycle, how, we start from, policy formulation down to implementation. And then a very important component of this is the monitoring and evaluation. So where we get to monitor policies. And I think one of the things that our research has shown is that, okay, fine, we're not having a lockdown now, but it's important that we actually took our time to really study the impact of this lockdown, monitor the impact of this policy, right, on the people, so that in case of next time, of which, it might not be a COVID-19, the learnings and the, findings that we've gotten from this, research, it will help the government and even everyone to sort of prepare, better for another, pandemic or another lockdown. So it was really, really insightful, hearing and from my two colleagues, Dr. Ibrahim and Dr. Adams. And, viewers, you're not left out, and our audience, listening, you can go to the NESG website, to download this report. It's about a 48-page report, and it's a really interesting report, and I think everybody should read it. So please just go to the NESG website and download the report. Thank you so much for joining us today. Thank you, my colleagues, Dr. Adams and Dr. Ibrahim and the NESG team. Thank you so much, and have a beautiful day.
Thank you for listening to our content today. Remember to subscribe to the NESG Radio. Follow us across all social media channels and visit our website www.nesgru.org/NESG Radio. NESG, in the national interest.